Dr. Mary Tilak's in the house. Doctor, how are you?
Good. How are you?
Would be doing a lot better if I turned your microphone on. How's that? Is it on? It's still not on. There you go. Now it's on. There you go.
Yes, it is.
Hey, I'm watching the stock market. Do you watch the stock market?
No, I don't.
No?
I have no time for the stock market.
No?
It's yours.
What do you do with all your time?
Take care of patients and enjoy my life.
You see a lot of patients in a week, don't you?
Quite a bit of patients, both in the hospital and outpatient setting.
In the hospital, I thought people didn't do that anymore.
But I do. I enjoy
You do
doing
rounds
that.
in the hospital?
Every morning.
Every morning you
Yes.
do rounds?
Yes, absolutely.
I thought rounds were kind of a thing of the past.
Well, it is becoming to most physicians. Most physicians do not want to do inpatient care, so they've come up with this pretty expanding hospitalist programs where physicians are there in the hospital 24/7 and they will admit for you. So you could utilize them anytime you want to, but that's not the way I like it. For my patients, when they are most ill and in the hospital, I think they would like to see me in the hospital. That's how I feel.
Wow, I didn't know that because, a lot of doctors in the family, one of them still does rounds.
Okay.
And he says he won't give that up, even though I think he's getting some pressure from some higher ups to, farm that out. But you have your own practice, so you don't have people telling you that you can't do rounds, right?
But look at it. It's all about revenue these days. So that's where I would like to differ from the general trend. So the revenue for a physician's time spent in the hospital, the investment is not good. You don't make money in the hospital for physicians.
Yeah, I mean,
Because it takes about an hour for me sometimes to finish a patient. While, if I spend that 1 hour in the office, absolutely I'm making a lot more revenue. But if that's all the reason why you're a doctor, then it is, life becomes really boring.
Dr. Tilak is an internist and
I'm an internist. That is my basic qualification, but I'm also a diplomate of the American Boards of Clinical Lipidology and Medical Bariatrics. These are organizations that basically train experts in weight management and lipid or cholesterol management.
And on a regular basis, doctor comes in and takes your phone calls, and we'll do that again today. If you have any questions, health questions, and so forth. If you guys listen on a regular basis, and many of you do because you mention the doctor, Dr. Tilak, when you guys come up to me, and I got to tell you, doctor, that I didn't think that this was really possible, but we do this show once a month, and then doctor has become my doctor. So I get to hear this actually off the air too, but it's really kind of a continual pounding of the ideas of eating healthily, but really it's kind of a knowing what is healthy. Honestly, I used to think if I went and took a big honking 16 ounce of orange juice that was real healthy. And you have dispelled that rumor and given some knowledge. And I've tried to eat just a little bit better. And I think it's partly just by this show and you talking and saying, this is where your cholesterol levels should be, and this is, the sugar. And then I'm starting to notice that if I eat a huge meal, then I feel kind of tired, and must be my sugar and that. So by eating a little more regularly through the day, believe me, I'm still a piece of pizza at 10 o'clock, and I know that's not cool. But at least the understanding that throughout the day you can maintain a decent sugar level.
Absolutely. I mean, I can see the difference in the several months I've been coming here. You look 10 years younger to me now than when I first saw you as. Literally. And even your perception, I feel, has significantly changed. You look more vibrant, more positive now than I first saw you as.
That cut down on the drinking a little bit too. So I mean,
yes, it is a question of lifestyle, and then you will realize what is true happiness and true quality of life. You kept telling me you were asking me to stop everything that is good in my life now, but now
that's what you did, and I come in there. I'm like, well, I do. I feel, I don't have enough energy sometimes, and you're like, well, you got to do this, this, and this, and I'm like, well, then how am I going to have any fun?
Exactly, but now you realize it's different. All of us kind of. I mean, it is a question of perception, but when you feel the reality, then you will understand that this is better.
It's getting really hot,
Yes.
okay? And I do this every year as I talk to the people that just won't take that into consideration, and then they wind up in emergency rooms. I mean, especially for older people, what do you do when it's this hot?
Well, first of all, you keep yourself well hydrated, and if you have medical problems and you are about the age of 65, I think you would want to be in the shade during the peak heat period. And just be conscientious of what you're doing during this time. Don't go and sit on the beach at this time.
And, it never ceases to amaze me, the 85-year-old guy calling up once in a while saying, well, I just mowed the lawn. And I'm like, dude, it's like, it's 85 degrees and it's going up to 95.
Right.
Why are you doing that? And there's just a mentality that I can beat everything, including the heat. And that one doesn't care who you are. The heat doesn't.
Absolutely. I mean, you have to listen to your body. I'm sure you will know.